TGA. I mean, Australia has a good one, so that just put themselves under it, and those are brands that I would trust, which I can give you a list of as well if you want.
So it's you kind of have listed here signs and symptoms of deficiencies.
Yes.
So, let's go through those, because what I hear you saying is that obviously if you feel like you have a deficiency, get tested. That's the first thing you should do. One, you could go into the chronometer and kind of get an idea, and then after that, get tested. And testing is always going to be the best.
Yeah, for sure.
At end result, because you're going to physically be able to see what's going on in your body.
Yeah.
But let's say you got someone who, feels like they're okay, but they're seeing some of these symptoms. What do those symptoms look like?
Okay. And let me just be clear, actually, the chronometer, if you're feeling unwell, signs and symptoms, you should go see a practitioner straight away.
Okay.
The chronometer is really for those of us maybe who are training, who are feeling fine, but just want to see, do I get enough of my micronutrients? Am I missing anything? Because some of these deficiencies, a lot of them are, as I said, insidious, and they may not be impacting you now, but in 5 years, you're going to see something. So those people that are feeling okay, but think, actually, I have no idea whether I'm getting a good range of micro, then look, because maybe you're okay, but in 5 years you may feel not great. If you do have any of these deficiency signs and symptoms, then you should go and get tested.
Okay.
So if we look even at vitamin D is going to, let's say we're getting recurrent infections, we're having, it's underlying, cardiovascular disease, autoimmune stuff, so inflammation not recovering, you're getting, when I say reoccurrence of infection, you're looking at like 3+ infections a year that shouldn't happen. You should, you're susceptible to picking stuff up. You're like, if someone comes to work and they're sick, I get it every time. That kind of thing. It underlies also anemia, so if you're tired, like general signs and symptoms of deficiencies, but again, it can be something else, but usually it's like chronic fatigue, anything inflammatory, skin issues, recurrent infection, prone to injury, like fractures, obviously, unless you're in like some crazy sport.
Yeah.
All the time. Heavy periods. So women are separate, right? And so.
So what is your definition of heavy period?
Heavy periods would be like more than 30 mils of bleeding. If you're like going through tampons or like every hour or so for like more than 7 days. Again, like always talk to your doctor about your period. Okay, like this is something I'm really interested in, because actually the research on women is pretty poor, and women are not given a lot of information. And your period health, a lot of people think how my period is just matters for whether or not I want to have a baby. But actually, your period health is a measure of a lot of other things going on, so including your performance. So to have irregular, people are like, oh, well, I have heaps of pain, but that's normal. It's not normal to have pain in your period, actually. That's not normal. And so bleeding excessively, not bleeding enough, these are all things that we can use to gauge what something going on in our body. And it may be a deficiency, it may be something else, but heavy periods can often mean there's not enough iron.
Well, I also remember you talking about how women are typically not included on drug experiments because your hormonal imbalance throughout the entire month regulates the testing.
Yeah, that's true. I mean, there's we've realized more recently, unfortunately, that well, I shouldn't say that. It's been around, but it's become more mainstream media that women haven't been properly tested. So there's not as much data. And so when you're being given data on, if someone's like, this is evident, it should be evidence-based, what you're choosing to do with your body, whether it's a diet or medicine. But often, if it's evidence-based, has the evidence been taken from women? And often what's happened in the past is men have been tested, and so we are seeing more women die of drug complications than men, which is often because they're taking too much. So that's of Western medicine, more interactions. Our liver functions differently. We process and metabolize drugs differently, and it's a really big problem. So yeah, I think we need to push hard on science to be giving us the data that's relevant for us, because it not only does it impact our health, it then impacts society as a whole because it becomes a burden. But it's really unbelievable how little women are researched. And you're right, it's because in the past our hormones have been seen as confounding variables. So they're too hard to control, and therefore, we can't put them in a randomized control study. It's easier to test men. And so it takes a little bit longer, but it is possible, and so we need to really advocate to have better research done on women. But it's true, yeah. But your hormones are really massive, and so your hormonal health is really, really important, and that's something you should be talking about with your doctor. And this includes,
and get tested for that as well.
Yeah, for sure. Yeah. Menopausal women, postmenopausal women, it's also important for them to make sure that they're receiving the right RDI, recommended daily allowance, or that meets their needs, because they have a drop in hormones, which then puts them at risk for other things. We see women are less at risk for certain cardiovascular disease than men at a certain stage of their life, and then we see a switch. Like postmenopausal women suddenly become more at risk, and it's like, well, why is that happening? And although it's still being looked at in research, it's definitely suggested that hormones have a role to play in that. And so also are women that think, well, I don't have periods anymore either. They're at risk for other nutrient deficiencies that are important to look at. Vitamin D is really important at that age, and B12. So it gets very confusing, but it's important.
But from the consumer, it's extremely, because you got advertisements that are pushing their own agenda. You have your doctor that's saying one thing, like you mentioned. A friend recommends, hey, by the way, this is what I take, I recommend you. Our members come to the coaches and the staff a lot about what supplements I should be taking, what micronutrients, what I should be eating, what I shouldn't be. Yeah. I do think that it can get a little bit too overwhelming or overwhelmed for most people.
Yeah, for sure.
Yeah, So I think if we were to give one piece of advice to them, that would be get tested, and then that way you kind of know where you're at, and then wherever you do go, they can give you the suggested.
Yeah, definitely. The one nutrient that's hard to test that also is really common that I want to mention briefly before we close is magnesium, and that's probably the most relevant for our community because you are more at risk of being deficient if you are training. So athletes, anyone who's training, more than a couple times a week is going to be more at risk for deficiency. And so, and in Hong Kong also just the humidity, and this is a hard one to test for. So whilst vitamin D, iron, B12, easy to test for, get it tested. If you're deficient, deal with it. If you can get it in food, great, but probably vitamin D, I'm going to say probably not. And I would look at getting a supplement through your doctor, D3. But magnesium is one that is is definitely a deficiency around the world, and particularly the people that have Western diets. They're going to be like a diet that's excess salt, so excess sodium, but equally so too low in sodium, is going to be more deficient. Excess alcohol, caffeine, any stress is going to burn through your, and remember, stress is like physiological stress, emotional stress. So it's like stress, the way we know it, chronic stress at work, psychological stress, emotional stress. But then if you're not sleeping, that's stress. If you're training a lot, that's stress. If you're exposed to toxins, that's stress. So the physiological stress on the body is going to burn through your magnesium stores. And the deficiencies are, you're at risk for cardiovascular disease, neuromuscular issues. Magnesium is required in over 300 biochemical pathways in your body, and it's a cofactor for heaps of other vitamins, vitamin D. So if you're deficient in it, you're at risk of cellular dysfunction, and cellular dysfunction is what leads to things like cancer, for example. Is when cells start behaving the way they shouldn't. And usually, like, basic symptoms to look for would be like lack of sleep is major, restless leg syndrome. This happens a lot for women, particularly in our luteal phase. So you'll see, like, I'm not really sleeping that great. Maybe like irritability, PMS. So these kinds of things, and if you know that the RDI, like if you get this from like leafy vegetables, whole grains, if you're eating those legumes, if you're eating those nut seeds. So if you have like 100 grams of spinach, you're gonna get 79 milligrams, roughly, right? So you need about 320 milligrams a day. But they say, like, there's studies that show that if you're training a lot, stressed women, you possibly need 20% more than that. Okay, so
and just to reiterate, magnesium is the hardest, even if you do get tested for it to.
It's really, it's I don't know, I've never seen it being tested before, but I know that some people will. I don't think I could be wrong, so I would need to fact check this, but it's not something that because magnesium is stored in your cells, you can't test it in the serum, blood, urine. So it's a difficult test to get a gauge on your status.
Yeah, okay. Can you have too much magnesium?
Yes, okay. Well, in theory, yes. In reality, it's probably if you're supplementing anything, then it's more, you're more at risk for going into a higher threshold. But the upper limits are pretty high, and if you have any of these risk factors for deficiencies, remember you're burning through the magnesium anyways. But there are some forms, I would say that 400 milligrams for someone who's quite active, living in Hong Kong, moderate to high stress, is going to be okay.
And taking that in the form of a supplement on top of what they're eating. Because let's talk members.
Yeah.
If our members are eating healthy, clean, they're getting the variety of foods, and they're taking supplements.
Yeah, so I would say, to start, that would be like a max. Okay, so you got to have a think about how much am I getting through my food, and then can I top it up? I take, for example, if you're working with a practitioner, it's likely they'll put you on a high dose of something if you're having these symptoms. But again, I don't feel comfortable necessarily putting that out there, because you can take, if you're someone who has at risk for any kidney issues, that can be really dangerous, right? And so someone who has any kidney issues, any supplement is going to be a lot. So if you're going to take a high amount of something, of anything, you should talk to your doctor. If you're taking, 250 milligrams, or you're taking on top of your food, is probably safe. But again, I would always just have a chat with someone, your doctor, just double check, because you are putting something into your body, and so you should be thinking about whether or not you need it. I would say though that if you are also taking magnesium, it's really important you have the right form. So magnesium, research shows, there's magnesium, the chelated magnesiums, magnesium bisglycinate, magnesium citrate, magnesium threonate have all been shown to have a higher bioavailability.
Okay.
Cheap magnesium is going to be like magnesium oxide, and that has lower bioavailability. It's going to, but interestingly, sometimes it's prescribed for different reasons. Like it has a laxative effect. So if you take too much magnesium, probably what's going to happen is you're going to get digestive upset and some diarrhea. And some people that take, especially magnesium oxide, that's definitely what's going to happen.
Yeah. Okay.
Yeah.
So in terms of, is there, when we're talking about chronic disease, do controlling the micronutrients assist with that, or at that point it's kind of?
Yeah, depends. I mean, when you say chronic disease, I guess, so atherosclerosis, for example,
which is
okay. So atherosclerosis, if you have restricted blood flow through vessels, where you have endothelios, so the cells that make up your vascular system, thicken due to fatty plaques, which is actually oxidized LDLs, and then also you have remodeling, where the muscle part of those of that vessel starts to hypertrophy and grow in. So you get basically narrowing of the vessels, which increases cardiac output. So your heart has to work harder, and eventually what can happen is you have what's called like these ischemic events. So when you have restricted blood flow to tissue, you have restricted nutrients and oxygen to tissue. And so what happens is that, again, atherosclerosis, like kids as young as 10 have it already happening in their vascular system, but you will not see the clinical manifestations of it until you're 50 plus.
And this would, if they had a cholesterol test, it wouldn't pop up on there? Or it could?
It could, but not necessarily.
Okay.
So if you have it, it's actually, it's not necessarily going to come up in your, and remember, cholesterol, like if you have high cholesterol, that's going to be called like hypercholesteremia, or like a dyslipidemia. So you have a imbalance or high, but that's not necessarily a diagnosis of atherosclerosis.
Okay.
They have to test it in another way. But this is something like if you have a Western diet, you eat a lot of sugar, you may have a genetic component, which is this is something that is happening in your body, and you're not going to see the manifestations of that until late. So in these cases, yes, making sure that you have micronutrients, like remember, we haven't even talked about antioxidants, because if you have a low antioxidant status in your body, you don't eat a lot of vegetables and fruit, then you're going to have more oxidization of your body. So then you're going to possibly have those endothelial injuries where, and that might not manifest as anything. And then later on you have, depending on where the injury is, then you start to have these ischemic events where you have restricted blood flow, or those plaques rip apart and they form clots, and then you have a stroke, or you have a heart attack, or you have, so these are things that, yes, I would say in terms of prevention, having those micronutrients sorted is really important. Once you are manifesting or you are diagnosed with something, there is still a role to play for these nutrients. So, but you need to more so be working with your doctor. You may need to be on medicine, allopathic medicine, but I would still say, you know, if you have low vitamin D status, your cardiovascular risk goes up, your diabetes risk goes up. So if you are not getting those micronutrients corrected, you're just you're putting yourself more at risk to further developing the disease or getting complications from the disease. Does that make sense?
It does.
Yeah. But these chronic diseases, and I think this is where, if you start to think about, it's hard, you know, when I was 20 years old, I didn't care about the ramifications necessarily.
I don't think most do.
Yeah. So
it's later in life when you start getting those nigs and pains.
Yeah.
And then realize this is not how, like, what normal is. This is not normal, or what I always thought. And I think that even the younger generation, people tend to drink. And you know, when you have an excess amount of alcohol in your body, and then the next day you feel off, but you repeat that cycle over and over, you never understand what your body should actually how it should properly be functioning.
Yeah.
But how it should actually feel.
Yeah.
You know, and even when you incorporate training into it, it's like, okay, utilizing your body as much as you can, but you know, the first time that they come in, they're sore. So that's from like a muscular standpoint, but everything else that you're putting into your body is fueling and feeding it. And are we feeling the repercussions right now, or are we feeling it 10, 15 years later?
Totally.
And most of us are very narrow-minded, or short-term, goal-oriented, rather than the long-term, or kind of looking at from a future perspective. And so I think this is where we just need to kind of change our mentality towards it, and continue to, you know, advocate for people of it. This is a longevity, we're living longer in our lives. But living longer doesn't necessarily mean we're living healthier lives longer.
Yes, exactly.
Or just our body status is still here, but mentally and physically, are we still at the capacity that we should be at?
Totally. And I mean, even with the ranges that we see, you know, you might have a test done and your doctor's like, well, you're within range, it's fine. But you really need to be, like, you want to be in the upper end of those ranges for health. And even with the RDIs, you know, a lot of the RDIs are still based around, you know, if you meet this, you're not going to get scurvy. If you meet this, you're not going to get rickets.
Yeah.
Well, I don't want to wait to get, you know, like, you'll feel really shitty a long time before you get scurvy, you know, and not be functioning at a high, even you won't have the quality of life. And so you want to, and it's hard, and I get it. I mean, I am now at an age where it does really matter to me, and I do see the impact of what I did when I was 20. And so I think making sure that you're informed, and also feeling, you know, generally kind of yucky, we get used, that becomes our normal, and we think it's normal that I'm tired all the time. And especially these ladies that are like moms, professionals, they're like, yeah, well, this is my life. It's kind of like this martyring. I just kind of keep strong, carry on, whatever. But actually, that's not normal. And you're functioning, but eventually you might, at the worst, again, get very sick. But also, you're missing out on what it means to feel really good.
And I think sleep is a big one. You know,
sleep's massive.
And that people think they can always make sleep up, when in reality, you never get sleep back. You know, you could sleep 2 hours last night, 3 hours, and think that sleeping 6 the next day is better than, no, is it better? Yeah, but you're never going to recoup from only those 2 hours that you had.
Totally. And having patience, you know, I mean, those basics, we talked about nutrient status, but I mean, the basics, if you're not sleeping properly, and you're eating not enough, too much, not, or in your highly stressed, those basics will always be relevant for a large portion of the population. So before you even think about going and supplementing and doing all of these things, that's the foundation you have to start with, and you can't cheat it. Like you can't game it. You can't. You just have to you have to move. You can't move excessively, but you gotta move. If you want to feel good and be healthy, you gotta move, and you gotta have good social support. Like those basic holistic things are pretty important. And then
but people want the short, they want the shortest route possible, and they don't understand that, living a healthy lifestyle is a long-term journey that we're going through. And talking about small diets that people put themselves through, as they're looking at, okay, well, this is going to get me from X to Y in the shortest amount of time.
Yeah. And I get it. I mean, that's the kind of world that's being broadcasted to us as well. It's like, I have this, it's going to make you feel like this in this amount of time. And so we're being hoodwinked. Like we're being tricked into thinking that we can achieve something quickly. And you're totally right. I mean, it is a long-term process, and and it should be something that we incorporate in a way that feels accessible also, and that we can manage, So what I can manage now with my health is maybe different than someone else, I could be doing a lot more, or I could be doing a lot less, and that's just based on where I am in my journey.
But it's taken time for you to get
fully.
Yeah.
It's taken me years to get here.
Yeah.
And I'm still growing, and I still have days where I just want to throw the towel in and say no more. But you can't borrow time, or you are borrowing time. It's like, if you're not willing to do it now, you will have to do it later.
Yeah.
So you are borrowing time from somewhere. It's like, if you want to. It's the same that I say, if I see people overtraining, it's like, fine, if you want to do it, you are borrowing time later from when you are overtrained and injured, when you can't do it then. If you want to not take care of your body, if you want to eat shit or not eat enough nutrient-dense foods, fine, but you will borrow time from somewhere else. And there's no gaming it. You can't, and if you don't want to do it now, fine, but you will have to do it at some point. And maybe later it will be harder. So
start now.
Yeah, like, ask questions. Don't be afraid to get things. If you don't have a good doctor, find another doctor. And this is me speaking to a population of people who are possibly in a more privileged position, that have more choice. And so we need to be able to advocate for ourselves, and build a support team, but also, we have to first have the impetus, like the willingness to be curious about our health in that way, and realize that it isn't when I'm in like 12 weeks time, then I can just be like, I'm out, like
yeah.
It's something that my nutritional needs are going to change again in the time of month, the life stage that I'm at. And we have to realize that, I really feel we have to move away from this, I'm on this X diet.
Yes.
Because there is no one size fits all to anything. That includes nutrients. If your friend is taking I'm on a high dose of B12 because I have a genetic issue that I can't access enough. I eat it, but I still have to take a dose. If someone else took the dose I'm on, they'd get really sick.
Mm-hmm.
So your friends are trying to help you, and they're excited, and we all get excited about our health, and we get excited to share, but we're individuals, and we have individual needs, and we have to be really, and we have to honor that and really be curious about it. You know, it's like, well, I had someone come into the clinic, and they're like, my friend told me, you know, I should take DHEA, and I'm like, but do you know why? No, it's just going to make me feel amazing. And DHEA is, you know, it's a hormone. There's a lot of reasons not to be on it. So you're an individual. You need to treat yourself and honor your own needs.
We're in a trance here. So if you had to give, you know, if there was one thing that you wanted someone to take away from this podcast, what would it be?
Well, I think, you know, look and see what your individual needs are. You know, don't think that more is better in terms of supplements. You know, make sure that if you are going to go onto a supplement, that you need it, and that it is a good quality supplement that is in a dose that's appropriate for you. So understand that you need variety, that you need all of your vitamins and minerals. They're all really important. A deficiency in any of them is going to have a knock-on effect to your health. Full stop. But going in and just buying a whole bunch of supplements and thinking that you're going to correct the issue isn't the way to go. And so think about getting it in your food, and then if you think you have a deficiency, then go talk to someone about it. Yeah. Try to avoid going on the internet and doing Dr. Google search, and go to speak to someone who has an understanding of how that can manifest in your body. Yeah, so it's simple, but it's complex, and we have to respect that the nuances of how things work in our bodies, and not just put things in our bodies without knowing where it's come from, what it is, what it's going to do.
And everyone is different.
And everyone is different, totally different. You are not your friend. You process and metabolize things differently. So you need to honor what your own needs are.
All right. A lot of information.
Sorry.
No, I think it's good. I think it gave a lot of context to people. You know, I think that the takeaway, like you said, is you need to understand that you're individual than everyone else, and the best way is to understand your needs, and to do that is testing and getting that done. And then at least you have an understanding is if you have deficiencies, and can you make those up. Obviously, if you're looking at food, taking a variety of food regardless. And then if you can get that through whole food, and if not, then that's where supplements come in.
Yeah, for sure.
Well, thank you for your time. This has been awesome. Yeah, let's do it again.
Cool. Thank you so much.